A woman, 75 years old, first visited on February 9, 1995. The patient had recurrent low back pain and leg fatigue for 3 years, with a history of hypertension, chronic constipation, and previous trauma from a fall. In early January, during housework, the low back pain became severe, especially in the right lumbar and gluteal region. Stretching or bending movements caused spasmodic or pulling severe pain. There was also severe pain in the lower abdomen below the umbilicus, accompanied by a subjective sensation of abnormal heartbeat or palpitations. Blood pressure was 170/106 millimeters of mercury. Appetite was normal, sleep was poor due to back pain. Bowel movements occurred once every 2 to 6 days, with normal stool quality. Tongue slightly red, coated with a thin, muddy-like substance. The pulse at the wrist was thin like a thread, tense, forceful, and rapid. The doctor considered that the patient had impaired blood circulation with accumulation of excess heat in the body. Prescription: Drinaria rhizome, gu sui bu, 30 grams, native copper, zidon tung, 30 grams, acaranthes root, huai niu shi, 30 grams, scrophularia root, suan shen, 20 grams, hemp seed, hua ma ren, 20 grams, ground beetle, di bia chung, 10 grams, dipsacus root, chuan duan, 20 grams, lindera root, tai wu, 10 grams, centipede, wu gong, 2 pieces, not decocted, ground into powder and mixed with the decoction, abalone shell, shi jue ming, 30 grams, added first. This was 1 day's dosage. The herbs were decocted in water, and the liquid was taken. The doctor did not specify how many times it should be divided. The doctor prescribed 3 days of medication. Second visit on February 16th, abdominal pain was significantly reduced. Blood pressure was 144/90 millimeters of mercury, but low back and leg pain did not improve. The doctor removed abalone shell and added cerealia fruit, 10 grams, and scorpion, 4 grams, not decocted, ground into powder and mixed with the decoction. The doctor prescribed 9 days of medication. Third visit on February 25th, low back pain had basically disappeared. Bowel movements occurred every 1 to 2 days with normal quality. The patient could take care of herself and do some light housework. The doctor made slight adjustments to the second prescription and instructed the patient to continue for 7 days. The illness was completely resolved, and a 4-year follow-up showed no major recurrence. Doctor's note: centipede and scorpion should not be decocted for a long time, as prolonged boiling reduces their efficacy. Grinding them into powder and mixing with the decoction yields better results.